Hi there, I'm Laura Abril, and I am honored and humbled to make this video to say thank you for being named a Hawkinson Scholar. I grew up in Arizona, but I moved to Minnesota to attend school at McAllister College in 2013, and I've been a Twin Cities resident ever since. I work at Optum as a healthcare consultant, and I've enrolled at the University of North Carolina at Chapel Hill to pursue a Master of Public Health in Health Equity, Social Justice, and Human Rights. My passion for equity and justice was fostered at an early age. I'm a mixed-race Mexican American, and my family comes from the U.S.-Mexico borderlands. As a person literally and metaphorically occupying two worlds, I have a unique insight into racial inequity. Because I'm often read as racially ambiguous, I've experienced a range of social responses to my presence. That, along with contrasting the way that society views each of my parents, has allowed me to home in on my future in the peace and justice movement, which is acting as a translator between two disparate worlds. I've applied that role as a translator to my current career as a healthcare consultant. I believe that health is the building block around which all other aspects of our lives are built. Without health, individuals and communities aren't able to thrive to their full potential, and I believe that equitable public health, which is the study of preventing disease, is a social justice issue. Access to health, health resources, and health literacy are inequitably distributed in the United States. As a young woman, I watched my low-income Mexican grandparents attempt to access health in a rural area largely populated by people of color, and the access just wasn't there. Whether consciously or unconsciously, our system suffers from bias that deprioritizes marginalized communities, including communities of color. This has never been more clear on a national scale as during the COVID-19 pandemic, as communities of color are disproportionately affected by the disease and are less able to access vaccines than their white counterparts. I decided to take action in summer 2020 through a development proposal submission to Optum for the first ever internal Health Equity Innovation Challenge. I teamed up with 4 other young consultants of color to propose a solution to addressing unconscious bias in the healthcare space. Our proposal won the competition and $25,000 in funding and Optum support for implementation. I have been program managing the implementation of our project over the past few months, and I've also negotiated partnerships to put our idea into action. For Phase 1, we are partnering internally with the clinical arm of Optum, who will be delivering foundational unconscious bias training to all clinical staff employed by our organization. To reinforce these trainings, we will also be partnering with a community organization that facilitates deep reflection through restorative health circles for Phase 2. This restorative lens to health justice will allow us to create a curriculum that deeply explores the trauma of unconscious bias perpetuated by the healthcare system and to train and inspire a fleet of clinical staff to begin to dismantle systemic bias and promote psychological safety for their patients. Recently, due to the success of the novel Health Equity Innovation Challenge, Optum has announced an annual $1 million in funding for the challenge in future years. It's an honor to know that the quality of our proposal prompted Optum to invest so deeply in health equity for years to come, and I'm excited to explore an expansion of our Addressing Unconscious Bias project in the future. One tenet that I explored in my undergraduate education was that vocation is where our deep passion meets the world's great need. I have a deep passion for facilitating connections between disjointed communities, like the current divide between clinicians and patients from underrepresented backgrounds, and the world has a great need for health justice. I am thrilled to position myself as a mechanism for peace and justice through the role of a connector in the healthcare space. My goal is that by grounding my work in vocation-based reflection, I can help equip clinical staff members to magnify their impact through sustained, career-long efforts to dismantle bias and pursue peace and justice. Through my graduate education, I seek to build my knowledge on best practices to scale up these types of community-based programs that help foster a movement of change makers in the healthcare space. I want to express again my deep gratitude to the Hawkinson Fund for making my dream of pursuing justice as vocation possible. Thank you.